I'm Dr. Lauren Hyman, and welcome to Scooch Down, where you can talk to your gynecologist like you talk to your friends. Today we're going to talk about long-acting reversible contraception or intrauterine contraception. There are two basic types of IUDs, intrauterine devices, hormonal and non-hormonal, and today we're going to discuss both. Many of my patients ask me what the difference is between them. Let's get that all figured out. Now, first off, about 30 years ago, there was a big scare with IUDs. The Dalkon Shield was pulled off the market because it caused uterine scarring and rendered some women infertile, and many people are still concerned about that. Those old IUDs had a multi-filamented string. In other words, the string that came off of the IUD down through the cervix had many different string parts of it, and it increased the risk of infection and scarring. The new IUDs don't have that. They are single filamented string, and the risk of infection is almost nil. We offer IUDs to all women these days, women who've already had children and women who are still thinking of having children in the future, teenagers, new moms, women who are entering into menopause who may still want some type of contraception. So let's get down to the two different types of IUDs that are on the market right now. The non-hormonal IUD is a copper T IUD. This type of IUD is inserted by the doctor into your uterus. The string comes down out of your uterus, and there is about 1 to 2 centimeters of string left below your cervix. The doctor cuts the IUD string, so it's just below your cervix, and if you put your finger in, you might even be able to feel the end of the string. This type of IUD does not have hormones in it. It will not change the timing of your cycle, but it could make your periods heavier and more painful, especially for the first year that you have it in. The second type of IUD is a progesterone-secreting IUD. There are several different types on the market right now that differ in the amount of years they can last in the uterus for and the amount of progesterone that is absorbed by the lining of the uterus on a daily basis. How does the IUD get into the uterus? Well, you come in for a doctor's visit. The doctor uses the inserter, puts it up into the uterus. Here comes the IUD. It's now in the endometrial canal. The string comes out past the cervix. It gets cut, and this is what's left in. This all gets discarded. And now you have an IUD in your endometrial canal with a little tiny string that you might be able to feel right poking out of the bottom of your cervix. With the progesterone-secreting IUDs, you may have some different hormonal side effects. There may be changes in your weight, changes in your mood, changes in your complexion. There can also be changes in your menstrual cycle, and a certain percentage of women with the progesterone-secreting IUD will stop having periods altogether. The benefit of this type of IUD, in addition to excellent contraception and for some women no periods, is that periods generally tend to be much lighter with this type of hormone in the system. And actually, this type of IUD is approved for women with heavy bleeding due to fibroids. So when you're thinking of a long-acting reversible type of contraception, you definitely want to look into the IUD, either the one that is non-hormonal or the one that secretes progesterone. Last thing to note, when you do want the IUD out of your system, maybe you want to start to try to have a baby. The doctor can remove the IUD. It does not have to be in your uterus for the allotted amount of time. And once it's out, your chances of getting pregnant return to baseline. This has been Dr. Lauren Hyman, and thanks for tuning in to Scooch Down. I'll see you next time.